One more thing I want to mention about the surgical experience itself. We talked about anesthesia. We talked about some of the potential discomfort you might feel. Is what it feels like in the operating room. I try to create a nice atmosphere in the operating room itself. I dim all the lights. The patient is monitored, but the monitor is silenced. It creates a very calm atmosphere. There's music, calming music playing in the backgrounds. The staff that I have, the team I work with is I think really outstanding in terms of patient care and making you feel comfortable and confident in what we're doing. But I've heard from some patients that it's unpleasant in there in terms of how it feels. Please understand that it is an operating room, and operating rooms can only be a certain temperature. Historically and by definition, we do what we can in terms of trying to create the right temperature for the patient themselves with warmers. But it's also, there's liquid too. This is water-assisted liposuction. There is a lot of fluid. So there are times when you're going to feel cold in the operating room, despite it not necessarily being that cold outside because of all the liquid. And shivering is another thing that patients say they commonly feel. And it's going on for a certain reason. I'm going to explain to you why it goes on. When you're doing it this way with the water and the fluid, there is epinephrine in the fluid too. And what the epinephrine is doing is it's causing vasoconstriction at the surface of the skin. And the skin surface tends to become a little bit whiter because the blood is sort of moving out of that area. You're getting vasoconstriction. That's one of the reasons why there's such a clean removal of the fat. But the skin gets cool along with that. And the natural response of the body is to shiver. So if you shiver during the surgery, I'm going to tell you that it's normal. Most patients tend to shiver during liposuction surgery, especially when it's done using wall in a tumescent fashion.